I want to say happy St. Paddy's Day for all of those who celebrate and all the green that are out there. I'm from Irish descent, and on the weekend I spent it at a local Irish concert, and they do skits there. And one of the skits, they had an obstetrician doing an interview for a session because the community's had so many babies born. And they asked the obstetrician in the skit, is having a baby painful? And the obstetrician said, yes, absolutely painful. It's so painful, actually, that women might understand what it's like for a man to have a cold after they've had a baby. Anyways, all joking aside, one thing that we have learned over the years is that women do actually experience healthcare different than men. And when we look at over the historically, research has been mostly done into male healthcare and how men experience illness and those pieces. And women sometimes it's different. And Kirsten shared her story about her family. I'll share mine. My mother at 66 passed away from an MI, heart attack. And women's heart attacks are very different than men's heart attacks and sometimes how they present. But we've all been taught that chest pain across your chest and down your arm. And with women, quite often, it's very different, and we haven't really been taught those signs and symptoms the same. But research and women in healthcare have actually done this type of advocacy that we actually do this research, and we actually now know that women present differently. And this is really the importance of these kind of sessions, is to really to know that there are different things that we need to learn about our health and how to manage it going forward. So much like Kirsten, I very much, since my experience with my family, had a desire to advocate for women's health. So I would ask you, how many people out here, if you could put up your hand and keep it up, have had a female member of your family that has been had the challenge of heart or stroke issues? Great. And then how many people would also say that they've had a female member of their family have a fractured hip or osteoporosis? And then how many people might have a female member of their family who struggled with mental health? Great. So I just came up with 3 different things that women experience that have nothing to do with our reproductive organs and our and those pieces, but again, that we really experience every day. But maybe we don't, as we talk about taboos, things that we're not allowed to talk about every day that are different that our women go through. So I think it's really important that we have days like today where we express the needs here and we advocate for our learnings. I'm Tab Carroll, and I am a health system executive clinical, like they indicated. I am responsible for areas in the hospital: emergency, surgical, critical care, medicine, women and children, and flow. And so in that, I have a broad team of experts, female and male. And I would say that we all see the importance and the advocacy that we have to keep that equity piece in our thoughts as we build our programs, so that it's not just the women's program that's responsible for all the care of women, but every one of my programs has an accountability for the care of women in those areas. And so I have to say we're in an excellent spot at Lakeridge Health right now, and I'm so proud to work at Lakeridge Health right now, because we are at the start of a strategic plan where we have the opportunity to rethink how we're doing things with the support of our local politicians, with the government, with our community partners, with our patient advisors. We have the opportunity to sit down and rethink how we do things in each program. And with our master planning grant and with the opportunities of new buildings coming and Bowmanville being twice the size of what it is now, we have the opportunity to rethink how to provide our services. How do we put female equity into all of our programs, not just women's health. And so, like I say, I want to say thank you again to all those who are contributing to this new culture of ensuring that we meet all of our community's needs. So in saying that, I want to let Julianne have the conversation to the topic that was really here, and I just went off on my own. But I really do appreciate all of you coming, showing your support for women's health, and taking the opportunity to learn how to make sure that you're looking after yourself so your families can have you for a very long time. Thanks.
I will just mention that for those of us who are vertically challenged, those chairs are really tall. My name is Julianne Francis. I'm a gynecologic oncologist. That was an excellent execution, by the way. Very well done. I've been at Lakeridge since 2009, actually, when we initially started coming from Kingston to support the Durham community. And in 2018, the community had expanded so much, it needed its own gyne-oncology program, which is what brought me to Lakeridge. I was going to present some slides today, but honestly, I thought it was going to be me and like 4 or 5 people in a room. I was mistaken, and realized that many of the slides that I was going to show might be something of a copyright violation. So I'm going to just speak to the subject here today. Now, it is really difficult to summarize the menstrual cycle or what goes on in terms of hormones in the female body in 5 minutes or less when most of the steps that I'm describing is a subspecialty of its own. But I will try to speak to it a little bit just so that we can get a general sense, and then I hope if people have questions afterwards that they feel free to reach out to myself or to one of my colleagues to get more information. Now, what many people don't realize is that your peak number of eggs that you have as a woman occurs, well, actually, I'll put the question out there. Does anyone know? No cheating gynecologist. I see I have my boss over here. But does anyone know? In the back over there. Inside the womb, exactly. Is that what you said? Yeah, very good. I'm impressed. Okay. So when you're about 20 weeks of gestation, you have the most eggs you're ever going to have. It's 6 or 7 million. And as many of us, those of us who are women, can understand, things just start to go downhill from there. When you're born, you're already down to 1 or 2 million. And by the time you get to be at puberty or at the time of your reproductive life, you're down to a few thousands of eggs. So really only 300 to 500 of those get released during your reproductive life. So of the millions that you started out with, only a few are working for you. So that whole idea of what happens with that egg is embryology. Now, in order to even reach puberty, and this is where I was going to have the illegal slide and slight movie clip about the movie Turning Red, which I thought was going to be really great. When we reach puberty, that is when we start having the sort of symphony of hormones, really. There are so many of them that contribute to what goes on with a menstrual cycle. But I always like to tell my medical students there's a couple of key ones. So the ones that you care about most are estrogen and progesterone. And I tell all my medical students that estrogen makes the grass grow and progesterone mows the lawn. And this is where I had the illegal movie clip with SB mowing the lawn, which I thought would be really cute. Yes, I like to watch people mow lawns in my spare time. We all have hobbies. And so the balance between these two hormones is really what causes you to have your menstrual cycle every month. The first half of this is called the follicular phase, and this is more the estrogen dominant phase. And this is when we're usually more energetic and in a better mood, and things are looking pretty good. And then around the middle of this time, around day 14 or so, your partner starts being a lot more interesting to you. For medical reasons. And at that time, the balance between LH and FSH, which are a couple of other hormones, cause the egg to be released. And after that, you're in the progesterone phase, at which point your partner might inform you that your mood has changed. And that there may be a few different emotions that occur, and that takes the second half. And if there is implantation or successful egg, then you will continue on in a pregnancy, and if there is not, you will enter your menstrual cycle, and this repeats again and again until you get to my second talk, which is the one that I'm really relating to right now. So the menstrual cycle is very important because it is a vital sign of women's health. And I think this is the moment where I want to take a little bit of time to talk about advocacy, because even though I'm sure most of the women, if not all in this room, have had a menstrual cycle at some time in their life, nobody really talks to us, I think, enough about what can go wrong with it. So we're learning so much more now about undiagnosed hematologic diseases where people bleed excessively and they don't know that they're bleeding excessively, because we never talk about how much a woman should be bleeding during her menstrual cycle. How many days should she be bleeding? How many pads should she be filling? Until very recently, all of the data we had about how much a woman should be bleeding was based on menstrual pads that were designed in 1969. If anybody in this room has ever used one of those, you'll appreciate how much more absorbent a modern tampon or pad would be in contrast. So the amount of bleeding that we would be telling people that would be normal was actually in many cases not normal. Nobody talks that much about how much pain you should have during a menstrual cycle. You know, there is some pain, there's not some pain. People know very little about endometriosis or what that could mean and how debilitating these kinds of pains can be. So I think that the place where we are now, where we have so many female physicians and researchers and people interested in women's health, male or female, doesn't matter who you are, just interested in women's health. And the types of things that we are learning are really going to change what the future looks like for the next generation and the one after that. So I would say that the future is bright. Thank you so much.